Hello, everyone. Welcome to Shifa Community Clinic's second outreach webinar. Today's topic is assimilating back into society with the ongoing COVID-19 pandemic. For those of you who do not know, Shifa Community Clinic is one of UC Davis's 9 student-run clinics that provides health insurance to the underserved and uninsured population of Sacramento. Our clinic has a plethora of health insurance. Our clinic. I apologize. Our clinic has a plethora of specialty clinics, including dental clinic, women's health clinic, legal clinic, diabetic retinopathy clinic, mind clinic, dermatology clinic, and podiatry clinic. We see patients via telehealth appointments and in-person appointments every Sunday of the month. You can schedule an appointment with us by calling our clinic at 916-441-6008 between Monday and Thursday. Please leave your name, contact information, and reason for the appointment. And our clinic is located at 419 V Street in Sacramento. And you can access this information on our website at shifaclinic.org. Our guest speaker joining us today is Dr. Richard Kravitz and Dr. Lorena Garcia. Dr. Garcia is an associate professor of epidemiology at UC Davis's School of Medicine. She will provide a brief overview of COVID-19 and review how you may protect yourself and others. And Dr. Kravitz is a professor and co-vice chair of research, Department of Internal Medicine of the University of California, Davis. He will describe how COVID-19 affects the body and explain why doctors think certain activities are riskier than others. He will also cover specific actions you and your family can take to reduce your risk of infection. Now, without further ado, we will give the floor to Dr. Garcia.
Thank you. I want to thank the audience for being here today. I would also like to thank the students from Shifa Clinic for organizing and putting together this timely event. Next slide. So before we begin discussing what a novel coronavirus is, let's begin with why is it called COVID-19? On February 11th, 2020, the World Health Organization announced an official name for the disease causing the 2019 novel coronavirus outbreak. In COVID-19, the CO stands for corona, the VI for virus, and the D for disease. COVID-19 is a new disease caused by a novel or new coronavirus that has not been previously seen in humans. There are many types of human coronaviruses, including some that cause mild upper respiratory tract infection. Coronaviruses are a large family of viruses that are common in people and many different species of animals as well, such as cattle, cats, and bats. Next slide, please. This is a map of the United States. The states with the darkest colors indicate where we are observing a large number of cases of COVID-19. The states with the lighter color are states where we are observing fewer cases of COVID-19. So as it is clear, if you look to the left of the screen, we see the state of California. We are seeing extremely large numbers. So these are cases from last week. We had fewer cases, over 6,500,000. As of today, we have over 6,700,000 cases. All of these numbers are freely available to you, and you can search this at the Centers for Disease Control and Prevention. There's a link, www.cdc.gov. So you can assess the numbers on a daily basis. So let's look further specifically to the state of California. Next slide, please. So here, this is the state of California, and these are numbers from last week. We are observing an increase. Last Sunday specifically, we saw over 700,000, close to 760,000 cases, and over 14,300 deaths. This week, today, this is also a website that is freely available to you. The link is below, covid19.ca.gov. So this morning, the cases rose. Over 775,000 cases today, and over 14,900 deaths, close to 15,000 cases. So you may start asking yourself, why are these numbers increasing? In April, we began to see the numbers of cases slowly decrease in California. However, with the fatigue that individuals began to experience with stay-at-home orders, many started attending large gatherings during the holiday weekends. such as the 4th of July and Memorial Day. Face masks and social distancing were not used in many, if not most, of these gatherings. At this point, numbers began to increase nationwide, not just in the state of California. In August, as students began returning to school and colleges, many young people began attending parties or giving parties, also going to bars. This also saw an increase in our numbers of cases. So the next question may be, what can we do as individuals to prevent being exposed? Next slide. We know what we need to do. We need to wear face masks and practice social distancing, but we also need to understand how the virus is spread. We know that the virus that causes COVID-19 is mainly from person to person, mainly through respiratory droplets that are produced when an infected person coughs, sneezes, or talks. Now, these droplets can land in the mouths or noses of people who are nearby, and they in turn can inhale these droplets into these lungs. So spread is more likely when people are in close contact, less than 6 feet. COVID-19 does seem to be spreading quickly, easily in communities, and that is why we often hear the term community spread. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. So you may be asking yourself again, so what can we do? If others do not practice social distancing or wearing masks, how can we prevent exposure? Again, so in this picture, you see a wide variety of individuals, a wide variety of masks. It's important to cover both your nose and your mouth. So you can have these masks in different colors and know that you can protect yourself even though others may not be doing so. Next slide. So in this slide, again, we can practice safe behaviors. We can wash our hands often. We can also avoid close contact. And when one is not able to wash one's hands when you rub them vigorously, make sure not to touch your eyes, your nose, or your mouth. And also, you can make sure that when you cough or sneeze for any reason, cover your mouth and your nose with a Kleenex, or you can also use your elbow. Cleaning and disinfecting is always important, but most important is during this time period. These are all behaviors that we can be practicing and to help us reduce the number of both cases as well as deaths. So this completes my portion of my presentation, and I encourage you to share this information with others and practice these healthy behaviors that we are familiar with and aware of. So thank you very much.
Are the slides showing? Yeah?
Yes, they are.
Okay, excellent. Hi, everybody. I'm Richard Kravitz. It's great to be able to talk with all of you today. It's been a privilege for me to work with the Shifa Clinic for many years. They provide great services to the community, and I'm really glad to see that they've engaged in this kind of outreach program, so I'm very happy to be a part of it. I don't know how much new information I'll be providing beyond what Dr. Garcia just told you. I thought her presentation was excellent, and so some of this will just be by way of repetition, which is always good for learning. So let's see. All right. So the first point I wanted to make about COVID, since the theme of this session is supposed to be, you know, how do we reintegrate into society? That's all about safety. And the first thing to recognize is that safety is never absolute. There's no level of absolute safety or absolute protection from the COVID-19 virus or anything else. And so what our aim is as citizens, as members of the community, as members of households, is to reduce our risk down to an acceptable level, and that level of acceptability may vary family by family, community by community. But there's basically two kinds of risks that we're concerned about. One is the risk of getting infected in the first place with the virus. This is a very widespread virus, and it spreads remarkably easily. Perhaps one feature of its novelty, as Dr. Garcia mentioned, this is a novel coronavirus, is its ease of spread, and in particular, the ability of the virus to spread from people who are not symptomatic, people who feel perfectly well. In fact, Dr. Anthony Fauci mentioned in a talk within the last week or two that the current estimates are that somewhere around 40 or 50% of all cases are spread from people who feel perfectly fine. So if you hear people saying, you know, it's okay for me to go out without a mask and hang around with other people because I feel well, I'm not putting anyone at risk, that's certainly not true. That's a falsehood. You can easily spread the virus without being aware that you're even infected. An asymptomatic infection is in fact more common among younger adults than it is among older adults, and the situation with children is still being worked out. So anyway, that's one set of risks, is the risk of getting infected in the first place. And the second set of risks is the risk of succumbing to serious illness or death. So like I said, the majority of people, or at least a large number of people, are asymptomatic. They feel perfectly well despite being infected. Another group of people have very mild symptoms, maybe akin to the common cold or an ordinary flu. And then a different group of people will get quite ill with fevers, muscle aches, cough, sometimes a whole array of symptoms that are somewhat unusual with other respiratory infections. For example, rashes on the fingers and toes, conjunctivitis, which is pink eye, gastrointestinal symptoms, and the like. But that group of people that I'm talking about now will be sick, but they won't be so sick that they need to go to the emergency room or to the hospital. And then there's a smaller group who will become sick, usually because of breathing difficulties, respiratory distress, and will need to go to the hospital, mostly for oxygen therapy. So they'll need additional oxygen administered through a nasal cannula or a face mask. And then there's a subset beyond that where people become extremely sick and need to go to the intensive care unit, perhaps have mechanical assistance with breathing, and that in some cases can lead to death. So there's these two kinds of risks: the risk of getting infected in the first place, and then the risk of becoming seriously ill and or dying. All right, so let's separate out these two things and look first at risk factors for infection. So there's a number of factors that can affect how likely it is that you as an individual will become infected with this virus. That's not to say how sick you'll become with the virus. That's a different story. We'll take that up on the next slide, but this is about your risk of getting infected. So the very first thing to consider is how active is the virus in your community. And you can see on this slide that's limited to Northern California, that even within this geographic region, there is variation in the percentage of people in a community who are currently infected with the virus. This slide is a week or two old, so, so the actual numbers aren't what's important, but the important thing to notice is that there's some kind of darkish orange areas and even reddish areas, which reflect a high proportion of people infected with the virus. This is the average number of people infected with the virus per 100,000 in that community in the past week. So red means up to 56, even 60 people per 100,000. And then these lighter, very light orange or yellow areas are less than 10 people per 100,000. So you can see the percentage of people infected in a community can vary tenfold or more. And that has a major influence on your risk of becoming infected when you go out and engage in community life, whether it's shopping in the market or going to school or attending work or whatever it might be. Then there's a number of other factors that come into play. And this little chart is actually kind of a nice schematic of the types of factors that make a difference. In general, outdoor activities are safer than indoor activities. Activities in which there's fewer people crowded together are safer than those in which there are many people crowded together. Activities in which people are quiet, either sitting or standing more or less silently, as opposed to activities in which people are talking, yelling, laughing, or in particular, it seems singing. You know, the one is safer than the other, and so on. And so you can see on this chart, there's this sort of a gradient from the lowest risk activities, where we're not saying anything is zero risk, but low risk activities like going for a walk or a run or a bike ride outdoors, you know, filling up your car with gas at the gas station, getting takeout from a restaurant, that all seems to be relatively safe. And then there's a gradient all the way up to the highest risk activities like large music concerts, going to bars or buffets, gyms, churches, synagogues, mosques, of course, or sports stadiums where large numbers of people are crowded together, particularly indoors, and are often engaged in loud talking, where there's a tendency to spew out the kinds of droplets, even very microscopic, very small droplets that Dr. Garcia was referring to. I have this point about ventilation up here to remind me that we've learned a lot about the virus in the last 6 months. And one of the things we've learned is that well-ventilated areas seem to be much safer than less well-ventilated areas, poorly ventilated areas. I mentioned outdoors better than indoors, but even indoors, the kind of the amount of air recirculation, the ability to open windows, and so on can be a very big and important factor. So let's see if I can advance this. Okay, yeah, and so these are the other things that that I've sort of covered as we took a look at the picture over on the far right-hand side of the slide. The idea of crowding being a risk factor, physical distancing. You know, the guideline in the United States is 6 feet. There's of course no absolute cutoff. The farther apart two individuals are, the less likely they are to spread the virus should one of them be infected. And then there's this idea of air movement, you know, so if we're all sitting very quietly together, 6 feet apart, outdoors, the risk is minimal. If we're sitting closer together and sneezing, coughing, of course, but also talking loudly, shouting, as you might see in restaurants, indoor restaurants or bars. If we're singing, there's a very famous incident probably 3 months ago during a church choir practice where despite dispersion of the members of the choir, at least 6 feet apart, there was still a great deal of spread within that choir community after choir practice. Of, I think, 80 people practicing choir, something like 26 of them became infected within a week or two of practice. Quiet talking seems to be much better. And finally, time matters. If you're a transient contact where you're within the vicinity of a potentially infected person for a relatively short period of time, 5, 10, 15 minutes is a lot less risky than being in contact for long periods of time. 15 minutes again is given as the cutoff, but again, it's a gradient, it's a continuum. So if you're exposed to an infected person for a longer period of time, that seems to matter because that gives more time for the virus attached to these droplets, these little particles, to emerge from the other person's mouth and nose, to float into the air and to make its way to you. And it does seem, although it has not been proven, that the dose of the virus has something to do with how sick the recipient, the person who becomes infected as a result of transfer from one person to another, how sick that person gets. So dose matters. Therefore, short exposures like passing somebody on the street, not to worry, really. Longer exposures going on past 15 minutes, probably a little bit higher risk. Okay, so what about risk factors for severe disease and death? What we just covered were the factors that predict whether somebody will become infected in the first place, but what makes the difference between whether somebody has either an asymptomatic infection, feeling perfectly well the whole time, or perhaps very mild symptoms like a mild cold or flu, or gets much sicker and might need to seek formal medical care or even be hospitalized? So the first two are older age and male sex. And you can see on this chart, this divides out males on the top and females on the bottom. First thing to notice is that at every age group, men are more likely to get severe disease than women. The difference in deaths per 100,000 is roughly 40 to 50,000 at each age gradient. So just taking, for example, men and women in the age group 65 to 74 years of age, the death rate for men is around 45 per 100,000. For women, it's probably down here at around, maybe 25 per 100,000. The other thing that's even more noticeable than the sex difference is this age difference. So you can see that the death rates for people under 45 years of age is extremely low. It rises very slowly, begins to pick up at about age 55 to 64. And then by the time you're over 65, it begins to go up. And then we get into a category of people where we've seen maybe 40% of the deaths in the United States have been in nursing homes. And that's typically in the older age groups. Okay, there's also, unfortunately, adding to the known health disparities that we've witnessed in the United States over time for a whole range of diseases, and in fact, all causes of death and disability. COVID-19 seems to be playing to the same tune, and African Americans especially, and to a lesser extent Latinos, are at higher risk than whites and Asians for severe disease. Finally, it seems that people with chronic conditions, especially hypertension and obesity, but also chronic lung disease, diabetes, and heart disease, are at higher risk for landing in the hospital or or even being intubated than people who are healthier. So I think this is my second to last slide. So, and this just kind of reiterates things that Dr. Garcia already made clear. But what can you do to reduce your risk of infection? Well, the first is sort of watch the headlines and keep track of what the prevalence of COVID-19 is in your community. Dr. Garcia mentioned the Centers for Disease Control has good links to maps and other forms of information that show what the community prevalence is. In areas that have very, very low community prevalence, there's a few counties like this in California. They tend to be exceedingly rural with very few people up in the far northeastern corner of California, as well as the very low southeastern deserts of California. Prevalence is quite low. And in those places, life can pretty much go on as normal as long as reasonable precautions are taken. And those reasonable precautions are the things that I'm going to outline below. In areas with higher prevalence, or in areas where the prevalence is rising, in other words, where the number of cases per 100,000 population is going up, then we all need to be a little bit more careful. And that's why some epidemiologists and policymakers have referred to our public health approach to COVID-19 as not being an on-off switch where we can suddenly go from a complete lockdown and quarantine to a completely open society, but rather a dimmer switch that gets adjusted according to the course of the pandemic. So the other tips are, of course, based on things I said earlier. These are probably not surprising to you, but avoid crowds for long periods, especially inside. Keep your distance, again, the 6-foot guideline. Wear a mask, and I'll underscore that in a moment. And if you suspect you may have been infected, or if you have symptoms that are consistent with COVID-19, then get tested, because contrary to the policy pronouncements of some people in the federal government, testing is a very important strategy to know where we are. If you suspect you might have been infected and you don't get tested, then you won't know whether to self-quarantine. And if you're out in the community, you could easily infect your friends, family, and other community members. So what about masks? Well, these numbers here on this diagram over here on the right are, I don't think fully evidence-based, but they give you a sense of what we've learned about the effectiveness of masks over time. So this is a bit of a hyperbole, a bit of an exaggeration, but if what the diagram is saying is if someone who's infected sneezes in your face and neither of you is wearing a mask, there's a very high rate of transmission. If you're wearing a mask, you can reduce that risk, but you don't reduce it as much as you might like, because some of these droplets are able to get around the corners of the mask, and you're able to breathe them in and get infected anyway. If the individual who's infected is wearing a mask, that's much better. That reduces the risk a lot. And that emphasizes the point, and it's so annoying to those of us who are concerned about public health when others say, I'm not at risk for COVID, I don't have to worry about it, I'm healthy, I don't need to wear a mask in public. That's fine if you only care about yourself, but one of the best ways to reduce the risk to others, should you happen to be asymptomatically infected, is to wear a mask when you're out in public, because that prevents droplets from getting out in the first place. And so this individual here is at much, much, much less risk. And finally, if both of you are wearing masks and keep 6 feet of distance, and especially if you're outdoors, the risk is about as close to zero as you can get. So the final, ask of our community is that people get tested. And just so you know, there's a bunch of testing sites in Sacramento. It changes weekly, if not daily. And so I'm not going to tell you where to get tested if you feel that you should be, but there are a number of potential sites. One of the first places to check in with is any health system that you might be affiliated with. I personally have been tested twice through Project Baseline, which you can find on the web. They've been doing free testing at Cal Expo. Many of the pharmacies are now doing testing, and maybe we'll hear from our SHFA clinic friends as to other sites where testing might be available. So that's all I have to say for now.
Thank you, Dr. Kravitz and Dr. Garcia, for taking the time to join us in this webinar and for providing this beautiful presentation. Right now, we will take any questions or comments from our audience.
So one of the questions we have is, when will a vaccine be made?
So I can tell you what I know, and then maybe Dr. Garcia can add on to this. You have probably heard that there are several large studies currently ongoing looking at the effectiveness and safety of a number of vaccines. One of the vaccines, I think, that's based in Britain, ran into some safety problems because of an issue with a single patient. I believe that trial has been restarted in the UK, but not in the United States. But the other studies are ongoing, and I'm going by some comments that Anthony Fauci made a week or two ago, again in the same speech that I referred to earlier, where he thinks that probably by the end of the year we'll have early results of several of these studies, and that by early 2021, perhaps up to 20 million doses of a vaccine will be available, which is enough to start vaccinating frontline health workers, maybe some essential workers and other vulnerable populations. But it, no matter what, even if the results of these studies are successful, it's going to take a while to gear up production. So I would say it's going to be mid-2021, probably at the earliest, before we have a fully functioning mass vaccination campaign going.
And I want to reiterate, absolutely, when we're thinking about a vaccine and vaccine trials, randomized clinical trials, critical and important is the health and the well-being of participants, and thinking forward in terms of safety for our populations. So these trials are well done, and the expectation is that we really provide, our communities with safe vaccines. So it will take longer, but it is for the safety of everyone. And that's why, to reiterate something that, many of the points that Dr. Kravitz and I concur with, is that while we do not have a vaccine, there are many things that we can do. So oftentimes we think of ourselves as being very healthy, but it may not be yourself. You may go on, if you become infected, you could infect another person that maybe is able to infect another person. And then we're thinking about individuals that have underlying medical conditions. They could be family, friends, and neighbors that may be aware of this or not, because there are also individuals in our communities. And again, to reiterate what Dr. Kravitz has noted, we have vulnerable populations in the state of California, for example, African American and Latino communities, individuals that are in this workplace where they are key and critical to providing transportation, care for individuals, and also individuals that provide the food and food needs that the state needs. So these individuals are very important. And so we have to think about, safety measures that we can take. Absolutely, it has been quite a long time, a few months. So it does become a bit stressful for individuals. And when we're thinking about mental health, for example, there is that isolation component that is critical, the depression. However, trying to figure out ways to help one another, and truly, when you protect yourself, you protect others, maybe not the immediate person that you are with, but thinking how that person connect to another and another. And so we have to take into consideration, again, individuals with underlying conditions, individuals that have underlying conditions and may not be aware of them. These are underprivileged, underserved communities that may not be diagnosed. They may have health conditions such as type 2 diabetes, which is quite high, we know, in African American and Latino communities. And again, to reiterate with Dr. Kravitz, this affects individuals at all ages, children, young adults, middle-aged, and older adults. So we have to think about the big picture and the long term. There is a professor at the University of Minnesota, Dr. Osterholm, an infectious disease expert, and he helps us to think about this pandemic in terms of the long haul. We really need to be thinking long term, and all of the steps that we can as individuals do. And information is, critical, and thinking about our communities and how different and unique they are in terms of modifying and being really smart about how we get testing out and to which groups. Some individuals, some groups, communities need to be tested. For example, colleges, several times per week, not just once per month. But you have to be smart about it and think about which individuals may need to be tested twice a week or maybe even 3 times a week. So I hope that was helpful.
No, that was. Thank you so much. The next question we have is any ideas about vaccine efficiency?
Well, I'm happy to start. So there, we don't know how effective the vaccine for COVID-19 is going to be. There's a couple of different approaches that the large vaccine manufacturers are using. I mean, one vaccine that I referred to earlier is using a different kind of very benign virus as the outer coat to deliver a bit of COVID genetic material, and another one is using messenger RNA, which is another kind of genetic material from COVID to try to produce an immune response. And so these different vaccines may work differently, but we know from our existing vaccines that there's a range of effectiveness and efficiency. So like if you're vaccinated against measles, according to I'm not a pediatrician, so I don't remember how many times my kids got vaccinated, but whether it's, if you're vaccinated according to schedule, maybe 2 two shot, two shots, three shots, one shot. I'm not sure. Lorena, do you
I think
remember?
it's two. I have two
Two.
sons.
Okay, good. Yeah. That you're essentially protected for a lifetime against measles. I mean, it's a very effective vaccine, and the protection is long lasting. And there are other vaccines like the flu vaccine that some years, depending on the type of flu virus in circulation, the vaccine is maybe 80 or 90% effective, and other years it's 30 or 40% effective. So the FDA has set out a standard that they're not going to approve a vaccine for COVID-19 unless it exceeds a 50% effectiveness. But that means it brings down the number of cases that would otherwise occur by 50%. So that's good, and that's helpful. But there's a way in which it could be bad if we all believe that vaccines are a panacea, and we stop taking and we have a less than 100% effective vaccine, or even a very effective vaccine that's not yet delivered to 100% of the population. We could end up letting our guard down and start to be less careful about social distancing and using face coverings and the rest. And if that happens, you could actually see transmission go up and not go down with the advent of a vaccine that's less than extremely effective. So we just won't know. We're going to have a lot of data by, I think, November and December, and then we'll have some early results on how the vaccines that are currently in the hopper are looking. And if we're really lucky, then one of them will be exceedingly effective and very safe, and we'll be out of this mess sooner than we had hoped. But it's also possible that we'll have something that's good, better than nothing, but by no means a cure-all.
Definitely, definitely. Thank you so much. The next question is, one second. What precautions should elderly that are 60 and older take when traveling in a 10-hour or longer flight? Yeah.
You want to take that, Lorena, or you want me to?
Absolutely. And I think, as Dr. Kravitz correctly pointed out, we're still learning. We actually have, if one thinks about it, learned quite a lot in a short period of time. With the advent of the internet, we're able to share findings worldwide with colleagues and scientists, but there's a lot that is still unknown. So, for example, with the study in the UK, there were individuals that, had underlying conditions that they didn't know about, and others that we did. So for older adults, when they're traveling, some of these individuals may or may not be aware of underlying conditions. And that's something that one has to take into consideration. And until a vaccine is safe and readily available, again, Dr. Kravitz, absolutely correct. It does take an extremely long time to make sure, to make that available to everyone, from the clinical trials to the, development and distribution. That is a long period. So until that time, it really comes down to, and I liked very, very much that slide. I'm going to borrow it, Dr. Kravitz, in terms of wearing masks and how we can absolutely not just protect ourselves, but others, and wearing that face covering the entire flight, nose, mouth, and at some point, glasses or some covering for the eye region. And so it's numerous things. The hand washing, we're able to do that. I'm not sure if it was transportation by airplane or train or bus, or just their own automobile. So it really, the context differs in terms of the space and ventilation. So if you're able to open your windows in your automobile, or if it's a bus, if you're able to, walk in and out, or the distancing. So it's very specific to the mode of transportation for older adults, but all of the basic safety and hygiene tips or things that we're aware of that both Dr. Kravitz and I have mentioned are important. So there's a lot that we can do, and the state of New York was wonderful in demonstrating that. At the very beginning, they did have a high incidence, new cases and high mortality with, convalescent home and older homes, but they were very, very smart in terms of opening very slowly, step by step, small increments, and stepping back and observing and seeing if the numbers went up or if they maintained or went down. And so they moved forward in such a slow and observant manner, working with clinicians, healthcare, and the Department of Health in the communities. And so now in the last 4 weeks, they've remained at a very low and flat level. So I see the state of New York or New York City being exemplary. They're a great example for us to follow in terms of older adults, but also, the entire age range.
Yeah, I would just add, I took the question to refer to plane flight. Maybe I misunderstood, but if that's the case, I would say that it depends how you define elderly, but I would say older person getting into their 60s, 70s, 80s should not engage in non-essential travel. So now the question is that is non-essential public transportation. So what's non-essential? So that's open to question, because there is some for some people, moving from one country to another or seeing family might be considered, very, very important. And for them, it's essential. And then the question is, how do you reduce your risk as much as possible? Fortunately, it's turned out that plane travel maybe isn't quite as dangerous as one might suspect. I mean, it's definitely an enclosed space, right? And people are close together. So it's already violating those two principles I talked about before. But it turns out planes recirculate their air in general really well. And so that's good. They turn over air 3 or 4 times as fast as it's turned over by most building air conditioning systems. And many airlines, but not all, have tried to space out their passengers more, eliminating middle seats and so on. So I would say the way to reduce your risk is don't go if you can avoid it. If you can't avoid it or you deem it essential, go. Wear a mask from the time you get to the airport until the time you get off the plane at your destination. Consider a face shield, because that may offer a little bit of additional protection. It's probably not all that important in the context of air travel. And try to space yourself out on the plane, except from other members of the party with whom you're traveling.
Good point.
Yes. Go ahead. Okay. Thank you so much for that advice. The next question we have is, what is the latest information about contracting COVID more than once?
Well, from what I understand, we really don't know if this does COVID-19, if there will be immunity, if it's 6 months, a year, or if it's lifelong. We do know, however, and we have seen cases where individuals across the age range, young, middle-aged, and older, where they are developing symptoms, 2, 3, 4, 6 months later. And so that may be an example of where individuals believe that they are being, reinfected and exposed. And we're seeing this in terms of it affecting, cardiovascular outcomes as well as pulmonary. And we're also observing cognitive health impairment. So that that confusion that we think occurs just at the beginning can occur actually much longer 3-4 months after. So that's, what I've been following in terms of what the scientific community is discussing in terms of that point. I don't know if Dr. Kravitz.
Yeah, I think the jury's still out on whether, like Dr. Garcia said, whether reinfection is a serious concern. There's been at least 2 case reports of people who had COVID for sure. They were tested. They several months transpired, and they were reinfected with a slightly different strain. It had very minute changes in the RNA, the genetic materials, indicating that it was not the same virus that just sort of was reactivated within the body, but it was actually a new infection. But those 2 cases are very few and far between. It does appear that there's some immunity that lasts at least several months. I think that's the consensus of the scientific community, that there's immunity that lasts at least several months. Whether it lasts longer is an open question. So what Dr. Garcia was talking about is sort of the longer lasting clinical effects of some of even the moderate cases of COVID. And that's a somewhat different matter. It doesn't have as much to do with reinfection as just the lingering clinical effects of this virus, which we're still learning a lot about. It's certainly an unusual virus in many ways, among which is that it affects so many different parts of the body.
Right. I just pointed that out because there are individuals that do experience these symptoms and they believe that they have become reinfected, not realizing that the symptoms can occur months later, and not just in older adults, 65, 85 and over. We've seen it in a few cases with children, an inflammatory response. And so some individuals in the community do believe that they are being reinfected, but what in reality they're experiencing are symptoms that can occur much later, months later, not a day or 24 hours or a week later, but 4 months, for example.
Okay, thank you. The next question we have is, as we begin our quarter at UC Davis, based on what has been said, will students be at a low to medium risk with policies in place?
I don't know if you want to take that, Dr. Kravitz, or should I?
Yeah, go ahead.
So on the main Davis campus, we are fortunate to have 2. We have the Davis campus and the Sacramento campus. And I'm not sure if it's an undergraduate and a graduate student, but for our graduate and undergraduate students at the Davis campus, we have the Healthy Davis together. And there's plenty of information online. There is going to be an Aggie ambassador. So that is students that are peers and educating, about, social distancing, mask wearing, as well as healthy behaviors. And I say this because there are numerous individuals, organizations on campus that are working together to make sure that campus life and the return is safe. And so much so that the university is working together with the community of Davis. Mayors, the mayor, departments of health, the school system, various small business leaders. So we're really trying to, and I say we because it's all of us as a community, to really extend beyond campus, because we know that a lot of individuals come to our campus often, whether they are or not students. So we want to be healthy together. And so the university, Chancellor May, as well as the medical school and the School of Veterinary Medicine, are taking a very proactive and interactive approach with the entire UC Davis campus community.
Perfect, thank you. So this question, you guys may have touched upon it a little bit. What are the guidelines for persistent positive test results in the community if the number of cases keeps increasing in one community? And how about with persistent negative results if the cases keep decreasing in a community?
Oh yeah, so I don't know, maybe Dr. Garcia, you have more detail to say. I'm not, I don't know the details, but the governor, has office has issued this 4-tiered approach where counties are classified into one of 4 tiers depending on how many cases there are per 100,000 in the community and which direction things are moving. And also one other metric, which you might have heard about, which is the percent of positive tests. So the percent of positive tests is the number of positive tests that week divided by the number of tests that were done. So obviously that can be affected by 2 things, how many people are getting infected and how many tests you're going to do. If you do a lot more tests, you'll probably have a lower positivity rate. But if you see that number changing, especially if it's going up, it could mean that there's a increased community prevalence. So depending on the tier into which your county is classified, there's different sets of restrictions, but that's about as far as I can take it.
That's perfect. I have nothing to add.
Okay.
Thank you so much. And I think that wraps up our Q&A section. But thank you so much for your time and answering all those questions for us. I'm gonna switch over to this.
I would like to thank everybody for joining us in our webinar today. Please come to our next webinar. It will be the following Saturday, September 26th. It will feature Dr. Samuel Diaz, and it will also be from 4 p.m. to 5 p.m. It will be another webinar on COVID-19, and it will be in Spanish. So if you know of anyone who would like more information and would like to join our translated webinar, feel free to let them know about this webinar that's upcoming. I would like to thank our speakers again for taking the time out of their day to join us in this webinar and to provide us with all of the wonderful information that they have both provided us. So thank you, Dr. Garcia and Dr. Kravitz. If you have any more questions, please feel free to email Shifa Community Clinic, and please visit our Shifa Community Clinic website. That way you can find more information in pamphlets and written for COVID-19 and other diseases. Thank you everyone for your time today.
Thank you for having us. Thank you. Have a wonderful weekend.
You too.
Yeah, thank you so much.
Thank you, Dr. Garcia. We have stopped live streaming on YouTube now.
Okay, I just wanted to make sure I didn't want to speak out of turn. So this is what you had in mind. I wasn't sure. I was trying to find and put resources for the community because I think oftentimes I'm very much into health disparities, social determinants of health. So it's all about empowering communities with information and having, the ability to go to the CDC in any language. I mean, they don't have every single language, but it's there. And so they can check the numbers, the language, and what's current. But also the other one, the state of California, and this way you can see, how the cases, unfortunately, we are increasing a little bit, but, and I think the last question was pertinent. The students are asking, is it safe to come back on campus, right? And a lot of programs are being put into place. I had started working a little bit at the beginning with the Aggie ambassadors and putting together the preliminary